Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University, with a joint faculty appointment at Ross University School of Medicine. In this video, I'll be going over some methods of study interpretation. I'll be focusing more on some of the measures of association that are common in epidemiology. So let's take a look. So some of the objectives involve understanding the source of biases. So when you're trying to interpret some sort of when you're looking to interpret a study and look for the measure of association, you have a number of biases that you have to reconsider. One is that determine threats to validity. Evaluate bias. So I'm going to be defining bias before looking at threats to validity. Evaluate confounding. This is a very important area that individuals have confused and confusion with. We're going to review the Hawthorne effect and then study limitations we'll be going over. So a lot of this is a combination of public health and medicine and many different components here. So when you evaluate bias, the conscious or unconscious influencing of the study and its results can make them less dependable. So that's not to say that certain study designs are not applicable. It just means that you have certain biases that may not be even aware of them, like implicit bias. That is something that should be evaluated. So bias can occur in a number of different ways, and it is important for researchers to be aware of these and find ways to minimize bias. So the idea is if you classify certain biases, then that will allow you to conduct the study more accurately, and then researchers, and I'll be going over limitations, but researchers that read the article are able to look at the biases and translate that over to their own research. And so medically speaking, you might get a question where they ask the type of bias, or they might even ask, is it internal validity versus external validity? And I'm going to show you a diagram which makes sense, and you will never be confused about the two. Threats to validity, well, these are some of the more important ones. I didn't define social desirability bias, so I'm going to go over this currently. So social desirability bias is more of providing responses depending on what people like. They just tell the respondents just because a researcher will take a look at it, they a lot of times want to provide responses which will sound like something the clinician is trying to understand. Now, looking into recall bias. Recall bias is when survey responses are asked to answer questions about things that happened in the past, but they might not remember accurately. And that can happen pretty commonly. For instance, hopefully the electronic health records make that less and less, but it's oftentimes when you have a lot of conditions, then it's difficult to remember all of them. Selection bias, research samples can sometimes underrepresent certain people or groups. So if you're doing a partial a sort of study or an observational study, this might actually be something effective. Hawthorne effect, or the observation bias. So by observing something, you kind of shift the bias, or the participants change their bias. And then confirmation bias is a type of bias that may occur during the interpretation of study data when researchers consciously or unconsciously look at patterns in their data that confirm the ideas of opinions. So it's a type of bias which is in interpreting the study, and consciously or unconsciously they're looking for patterns in their data, and that then leads them to a confirmation bias. Hawthorne effect, this is a good figure to look at. With the binoculars, there's no effect, but then the observer, by looking, has a different effect. So here's a case study. You're a physician in a large oncology practice, and the pharmaceutical representative has provided numbers, and you're trying to determine how many patients you'll have to treat with this new drug for lung cancer to see any benefit in comparison to another drug. So in a large oncology practice, the pharmaceutical representative, and this is actually pretty realistic. So let's start off by some basic definitions and build our way up. So just thinking about what absolute risk reduction means. Basically, it's the proportion of patients or individuals within the community, if you're building an intervention, public health focused. So it's the number of patients who are spared the adverse outcome as a result of having received the experimental rather than control therapy. So if you're talking about, some sort of intervention, could be even behavior change, maybe some sort of smoking cessation intervention. So that's, of course, risk reduction. So in terms of the relative risk reduction, that was absolute. That is how much the treatment reduced the risk of bad outcomes relative to the control group who did not have the treatment. So one is absolute and one is relative. So the next question that might be going through your mind is that, is this something that people bother about? And the reality is yes. Number needed to treat is in the last 3 decades have just they have just expanded to the point that it's being reported a lot more frequently. So yes, this is something that is important to focus on. So in this slide, we are going to be going over external validity versus internal validity. I feel like this is a good figure to be explaining the difference between the two. So target population and the sample, when this is affected, that's considered external validity. Now internal validity, that is actually in the actual study, and that's really important. Now, there are more types of biases: selection bias, misclassification bias, and that can be differential versus non-differential. So typically, when you're going away from the null, and then typically it's non-differential. Now, if you're going towards the null, then that's differential. So in the exercise in pregnancy example, the odds ratio estimate based on the biased data was biased towards the null. It's closer to 1, the null value for odds ratios. But it could just as easily have been biased away from the null. Some older epidemiology textbook will say that non-differential misclassification always biases towards the null, but then that turns out that it is not to be true. It's best to assume then know which way the bias is going. So this is kind of a busy slide, but nonetheless very important. What I'm going to do is put some marks on here so you can really easily follow. So the first thing I wanted to take note of is experimental versus observational. Can anybody say what's the difference between the two? Well, if you're answered experimental versus observational, where there's a lot of randomized controlled trials, and observational is they're not randomized, so there's not any sort of analysis that you have to be thinking about. I wanted to then bring your attention to down here where there's internal validity and external validity. So as you can see in internal validity, there's a high internal validity, but then low for observational internal validity. External validity actually is low for experimental, but very high for external validity. So there's a high external validity and then low to moderate external validity. I'm just gonna so there's high external validity and low internal validity for case control studies. All of the other portions, they're not too important here because we're mainly talking about validity. So high, this is actually not threats to internal validity, but high internal validity, but low external validity. But then everything else is pretty high in external validity. So what are threats to internal validity, or what are they? So you have behavioral biases, and then you have population biases, and then content biases, and linking biases. So content biases and linking biases is about collecting, processing, analyzing, and evaluating. So when there's hindrance in any of these are considered biases. So where biases come from, functional biases, normative biases, external biases, and non-individual. So that's a type of population bias. So just go through this, and there's a lot of different types of biases. And you can classify it by collection, maybe the processing, analyzing, then metrics evaluations, and interpretations. External validity types, well, we went over these, but population, setting, task, stimulus, even temporal and social. It may be that temporarily something was different, and then now you're kind of looking at it socially. I wanted to go over the concept here of understanding how a real publication looks like. Here you can study confounding by seeing that some of the confounders like age, gender, ethnicity, poverty was controlled for, The idea is that we want to make sure that we're considering apples to apples. So what I mean by that is that they have to be similar in some way. And the idea is maybe individuals that had food insecurity and that association between food insecurity and mortality was actually coming from there being disparate food insecurity between males and females. But when we control that, we can no longer make that conclusion because that's a confounder. So this is a diagram that I made for the study that you just saw. Placebo effect is something that is especially important in randomized controlled trials because there's the positive response in a treatment without active substances. So surgery, injections, pills, and the gold standard is silver color and white. So in research, this takes place in clinical practice. So this concludes this presentation. I hope you've learned some of the sources of biases in the literature, and I hope you also understood threats to internal and external validity. Thank you for listening. So this is some bonus content that I included here. One of the things, this is a real life study, and one of the things that's important is to also think about the social desirability bias. And if you don't remember what that is, then go back please to the lecture and take a look at that. So there's also, so this is the limitations that I acquired from the same article that I showed you. And that is, of course, self-recall bias is another one. Self-reported bias. When you have self-reported data, then social desirability bias, so things like even observer effect, the Hawthorne effect, where maybe the researcher is right there, and this makes for social desirability bias. But recall bias is important as well in this study because it provides the potential for not recalling what the starting point was. So resulting in varied follow-up among different cycles. Finally, mortality and health status can be influenced by a variety of factors. So this concludes the presentation. Again, I hope you've understood even the application of some of these biases, many of these that are internal biases, and be able to potentially do a study there. Thank you for listening.